Bonjour and welcome to the Dr. Rose Biohealth podcast. Today I'm very lucky to be joined by specialist paediatric Dr. Agnes Roze.
Thank you,
welcome.
Charlotte.
And I also have the very lovely Dr. Nicolle Ranzan.
Thank you so
our
much.
Specialist general cosmetic dentist.
Perfect.
Welcome
Thank
to
you.
the show. Pleasure having you. On today's episode, I would like to discuss the importance of pregnancy during dentistry. So, why does being pregnant change from a regular patient?
Yeah. So basically, when you are pregnant, right, you have many changes in your body, starting off hormonal changes. So it regulates everything pretty much. And these hormonal changes can lead to an exaggerated inflammatory response. So in dentistry, this is the most important thing, right?
And whatever you're going to do during your pregnancy as well, it's going to have an impact on your baby, even if it's still in utero. Whatever you're going to eat, what's going to be your oral hygiene, everything's going to have a little impact because teeth are starting to get formed starting from the 6 weeks in utero, and it's going to continue until the wisdom teeth, which means 17, 18 years old.
It's crazy because everything's just connected.
Yes, it's true. It's true. So it's very, very important in dentistry, particularly to have, if you are planning to conceive, it's very important, let's say, to book your checkup before, discuss that with the dentist. It shouldn't be a problem, and your dentist can assess your mouth, right? Do some x-rays, take some x-rays, right? Address any infection or any cavity that you might have to help you before you get pregnant, basically.
So what changes do we experience in terms of, you mentioned inflammation?
Yes, exactly.
Any other changes, like maybe like bleeding gums?
Yes, exactly. So gingivitis is something very common, and I like to do a comparison. Okay, if you compare a non-pregnant woman with a pregnant one, if you accumulate the same amount of plaque, same amount of bacteria, because you have your hormonal changes once you are pregnant, you're gonna respond to more inflammatory response, right? So you're going to have more bleeding gums, more swelling. And this is something important. It's not that the pregnancy will cause the gingivitis, the inflammation on the gums, but due to plaque accumulation, it will respond more aggressively. So it's very, very important to take care of it. And even periodontal disease is linked to many other factors. There are some observational studies even showing, right? Preterm birth, right? Mm-hmm. Low birth weight. It's not completely proven. We have still some researches ongoing, but this is such an important topic because basically, even if you control very well your gums, and if you control very well your oral hygiene, it can have a massive impact on your baby. So this is an important topic for sure.
So you're a mother. What changes did you experience when you were pregnant?
It's true that your gums and even sometimes your teeth are getting more sensitive, and you have a tendency to bleed more. I mean, you have more bleeding gums. So you need to be extra cautious, with your oral hygiene. And it's so much important to have everything checked. I would say, like Dr. Nicolle said, before even getting pregnant, because once you're pregnant, there are some things that you can't do or you don't really want to do because it can harm your fetus, your baby, or it's a bit more risky. You can still do some dental treatment because it's always better to, remove an infection and all this than having something keep in your body, something infected. But if you can assess everything a little bit before, that's much
better.
So you would definitely recommend having any dental treatment done prior to conceiving?
Yes, if possible, this would be the ideal world, right? If we can recommend, that would be definitely the ideal world. But
I would say don't be scared. I mean, if you're pregnant and you have a dental issue, like you feel pain or there's something, go and get it treated as well, because we have all the protection for the X-ray, everything, so that you can get your teeth fixed. Because if you let the situation get worse, you don't want to reach a stage, then you have to do something in emergency, and then the trauma is even worse. All the stress and the pain and the infection and things will be even worse. That it's better to do something and go check with your dentist, even if you're pregnant, because nowadays the techniques and all the things we have, especially in biohealth, there's lots of way that we can help you without harming or your baby or yourself as well. Yeah.
In this topic, even digital x-rays can help. There are much less radiation, right? And we can use a thyroid protection, a body protection. So it should be safer.
So during pregnancy, you can still take x-rays.
Yes,
and
you can.
It's not going to be harmful.
You can, ideally on the second trimester, but if you read all guidelines for pregnancy and dentistry, even according to American Dental Association, you can still take x-rays, of course, with all the protections. What you cannot do, or you should not do, is to take an x-ray just to do as your annual checkup once you're pregnant.
So maybe if I have pain, or if I'm experiencing a dental issue.
Of course, then we should definitely address that situation, and it's safe.
It's very good to know, because I feel like a lot of patients, they do fear as soon as they know they're pregnant, they try to avoid the dentist, and they don't want to take x-rays necessarily. And what type of treatments can I do then if I was pregnant?
So prevention, absolutely. Your hygiene appointments as well.
So cleaning, scaling, polishing is still completely safe.
And if you have any dental issue, let's say an infection, so it's also advised to treat rather than just keeping, If it's a treatment that can be postponed, like whitening, for instance, of course, we are not going to do during pregnancy, or even a minor restorative procedure, then we don't need to do mandatorily during pregnancy. But if it's an acute and emergency, then we should.
Okay, so avoid whitening during pregnancy.
Yes,
because a lot of our patients, they do
yes, absolutely,
like to maintain their teeth and have the whitening for an event. But if they're pregnant,
well, there is no research. There is no research showing it's going to be harmful, but ideally we should avoid.
Okay, so what other treatments? So fillings are safe to do during pregnancy?
Yes.
Possibly. What about surgeries?
Surgery, if it's a surgery that we can postpone, right? If it's not something like there is an emergency or so, we can postpone definitely after the
so extractions, implants.
Yeah, well, it's less risky to do it in the second semester. Ideally, we try to avoid the first semester and the last semester because it's going to have more impact. So if it's something that we can a little bit plan, then we'll do it during the second semester. If it's nothing urgent, as Dr. Nicolle said, better to postpone after the pregnancy and the delivery. But if it's something where there are symptoms like pain, swelling, anything, you need to address them. Don't let them stay in there.
Exactly.
Can we practice all types of interventions? And we just touched on that.
Yes.
So surgeries you would postpone until a later stage.
I think it's important to mention as well that during pregnancy, especially in the first trimester, is super normal to have nausea, episodes of vomiting, and so it's very important as well to take care of how we can remineralize the teeth, right? Because you are exposing your mouth to more and more acids, right? Plus, you are eating a little more carbohydrates, so you are contributing to have a more acidic environment in your mouth.
Craving.
Yes, exactly. So it's something very important, because it's not that because you are pregnant you're gonna have cavities, right? It's not that, but because of this acidic environment, it could be a little bit easier to get some cavities. Changes in diet, etc. So it's also advised to discuss that with your doctor. Erosion is something that can happen, of course, if you have too many episodes of nausea and vomiting. But it's something that your dentist can definitely help.
Yeah, it's really important to look at that. Like as you say, your diet's going to change. So when you change your diet, you're going to change the acidity in your mouth. So the saliva is going to change. All the oral microbia you have is going to change as well. So it's really important that you manage a balance in terms of what you eat and especially the minerals you bring, because that's what's going to help your teeth to stay strong, and that's going to affect your baby's teeth as well because they're developing. So you have to focus a lot on your diet and how to bring more minerals into your diet and vitamins as well, because you can't fix certain minerals if you don't have certain vitamins as well. So I think it's good to discuss with your dentist, okay, what is the best way that I can keep my mouth, not acidic, and help my saliva remineralize the teeth, and make sure as well my baby got enough minerals so that he's building a stronger teeth as well. So Dr. Nicolle is right, especially with the nausea and everything. We're really changing the pH in our mouth. So it's something to be cautious of, and lots of things going to help. You can change your toothpaste. You can do some different, mouthwash, specific mouthwash with minerals.
Wait a little bit to brush, right? At least 30 minutes after an episode, you wait a little bit to brush because the acidity in the mouth is very high. So we have many tips to give, basically.
Yeah, exactly. And drink plenty of water. Water always going to be the solution because it's going to wash away a bit the sugar, the acidity. It's going to help the saliva. The more saliva you get, everything. For water.
Yes.
And during our consultations here at Dr. Roze BioHealth, we usually do address looking at the overall health of our patients. So these are things you'd ask a normal patient, whether they're pregnant or not, supplements, diet, lifestyle. Yeah. So
our patients are already used to that.
It's good that we're educating them constantly.
It's important to bring back the mouth into the body and not treat it as a separate organs, because actually everything is related. So whatever happens to your mouth is going to go into your digestive system and everything.
So prevention is a big
and it wouldn't be different to pregnancy, right?
Yeah, totally agree.
So doctors, would you advise if I was pregnant and I wanted to come to the clinic, would I need more follow-up appointments, more like regular checkups, would you say?
It depends.
Or only if I have an issue? Yeah,
it's a particular situation. Together with the patient, right? We will establish basically if it's going to be in 3 months, in 6 months, or 2 months. We are going to establish depending on the individual situation, right, of our patient.
Because they don't have the same diet, they don't have the same oral hygiene, they don't use the same toothpaste. So I think it's very important, as Dr. Nicolle said, that we individualize every treatment and every supplement we give and everything, because we, at the end of the day, we're all different and react differently as well.
If it's a new patient and if it's not, everything, basically.
Interesting topic.
Interesting. I haven't yet experienced pregnancy, but maybe
me neither.
No, it's always fascinating, all these changes, and how can the little things have a big impact later on yourself or on the baby. Especially I think now we're more aware of the use of medication and, for example, antibiotics, how they can affect the baby's teeth, because before, tetracycline was well known for, if you take it during pregnancy, then you have some gray coloration on your teeth. So I think people are a bit more aware now of whatever you put in your body is going to have an impact not only on you, but on your babies as well, that is growing and forming. So I think it's nice to be able to discuss all this, because sometimes some of the things they know, but some other they don't know. So it's good to do, like you said, a general checkup, address every subject, so to be sure that the mother feels, is safe and in safe hands as well.
And you spoke about medication. There are some anesthetic as well that can be harmful, and that can be used. So it is safe.
So can we have anesthesia?
Of course, we need to. Yes, of course, we need to check each case, right? We need to discuss maybe with the obstetrician and so. But yes, it is safe, especially lidocaine. There are few classifications that we can go through, but it is safe during pregnancy. But of course, we always address with the obstetrician. Yeah.
And I know in our clinics we're also offering a painless experience now. So I think a lot of our patients, they like to go for treatment without using anesthesia.
Yeah, if it's possible, why not? Fillings. Yeah, why not?
You always have to consider a bit the stress that it's going to be without the anesthesia, compare of the anesthesia, because we know as well that no, and the stress has always bad effects as well. So you have to balance what the best things to choose. Either I'm going to be super stressed and don't get the anesthesia, or a tiny bit stressed and then I feel quiet and relaxed. So each case is different. So
I just had just remind me a patient that I had that was using laughing therapy, and she didn't take any anesthesia. She was using laughing therapy during the whole procedure, which I would consider using anesthesia, and it went fine.
Really?
Fine.
Was she laughing at the end of it?
She was laughing, definitely.
that's good.
Yeah.
Well, at least these services are available now.
Yeah.
There's so many alternatives. So.
For sure. Yeah. I think the takeaway message is during pregnancy, of course, you have some hormonal changes, right?
Oh, us women have hormonal changes. Anyway. That could seen me last week.
That could lead some inflammatory response. Let's say in the gum, you can have gingivitis during this process. So ideally, you could visit your dentist before conceiving, right? But if you conceived already, there is no problem to visit your dentist. We would even advise,
just to play it safe.
Yes. And there are some treatments. If it's not urgent, then we postpone. If it's urgent, of course, it's okay to treat, and we should definitely treat. I think that's the takeaway message that our audience should take, right? Yeah. And any other consideration?
I think what you resumed the things very well, I would say, and cautious with your diet. Remember to think about minerals and think to keep your teeth strong and healthy, and to build for your baby strong teeth as well, because they start forming still in the womb. Yes. So that would be that. Take care of yourself, because it's going to have an impact on your baby as well.
Exactly.
So,
Yep. Wow, thank you so much, doctors. There's so much that I've learned today. I know this will be very helpful for a lot of our patients, a lot of our listeners. Stay tuned for our next episode.
Yeah.
Thank you.
Thank you for joining us.
Thank you.